I'm Dr. Judy Melinek. I'm a board-certified forensic pathologist, and I just watched the Nolan Wells press conference, and I wanted to share some context for everyone. Being able to definitively state the cause of death after a body has not been found for several days and has been subsequently autopsied twice with signs of decomposition is incredibly unlikely. Drowning is what's called a diagnosis of exclusion, which means that when you've got a fresh body, you want to be able to look at the body and see if there's any other causes of death for that body that is found in water that exclude the death being exclusively a drowning. So for example, if someone is shot and then thrown in the water, you'll have that gunshot and they'll be bleeding and the gunshot will be the cause of death, and the thrown in the water is not the cause of death. It's not even on the death certificate. If a person is strangled and they die from strangulation and then their dead body is thrown in the water, their body will take on water, but the cause of death is going to be strangulation, not drowning. Also for any kind of traumatic injuries. Now we got to talk about natural death for a second. If someone has a heart attack while they are swimming, and because they're having the heart attack as they are exercising in the water and they take on water and they drown, the cause of death is actually drowning, and the heart attack is listed on the death certificate under other significant conditions contributing to death. So even though the heart attack might have killed them on dry land, it might not have. Most certainly they wouldn't have drowned on dry land. So we defer to the hostile environment, which is the water, to call it a drowning. Now, identifying natural disease and identifying trauma is relatively easy in a fresh body. It can be very difficult in a decomposed body. His body was found 2 days after he disappeared, and this second autopsy done by Dr. Roger Mitchell wasn't until 4 days later. So we're dealing with quite a bit of decomposition, even if the body was refrigerated during that time. And then we have this other issue of the fact that not all the results are back. The toxicology would have been done on the fluids from the body from the first autopsy. From the second autopsy, you're going to have a lot higher alcohol levels from the decomposition caused by bacteria, not caused by drinking. So again, it's the fluid and blood from the first autopsy that really matter. And the other thing you have to consider, and there's one other important piece of information from that press conference, which is that the neck block, the portion of the neck from the front end, was missing. So Dr. Mitchell did not have a chance to examine that part of Nolan Wells' anatomy. Why is that important? Because if somebody is strangled, especially manual strangulation, the injuries are going to be to the front of the neck. There may be some redness at the back of the neck as well if, injury comes from behind, but generally this part of the neck doesn't have the major blood vessels and the airway. It's the front of the neck that does. So compression or damage to the front of the airway, that's going to be found in the neck block that is still sitting at the medical examiner's office that was not released with the body. So you may ask, is this common practice for pathologists to keep a portion of the anatomy with them at the medical examiner's office and not release it to the family? And the answer is yes. We will sometimes retain important specimens that have pathology in a jar under formaldehyde at the medical examiner's office for further examination or as evidence. And the absence of that neck block is really important because we still don't have information from the first autopsy that has not been released yet. So we don't know if it was kept out of an abundance of caution, meaning that it didn't have any findings and it was negative, or it was kept because it has findings, because there's a broken hyoid bone, or because there's hemorrhage in the strap muscles. Until we get that first autopsy report, we don't know why it's been retained. So why should anybody do a second autopsy? A second autopsy is often done in cases where there is a high-profile case such as this, or there is concern from the family for foul play, and they're just not getting answers from the medical examiner's office because the medical examiner's office is still doing their investigation and is keeping things under wraps, because if there is foul play, they have the evidence, they have the physical evidence that might be able to trap the killer, and they don't want to release that to the public. Even if there is no evidence of foul play, just the lack of evidence is evidence and is important information that might affect how people are interrogated, whether they're going to tell the truth or not the truth about what happened to him. You have to understand that the medical examiner's autopsy is legally mandated, and it is ultimately the most independent autopsy because it's not beholden to the family, it's not beholden to the prosecutor, to the police, to anybody else. It's an independent agency. So that is an independent autopsy, but it takes time. And it takes time until we get all the information back, including the toxicology report. And to answer the question, if somebody's intoxicated and they drown as a result of their intoxication, meaning that they're just, too intoxicated to be able to swim adequately, the cause of death would still be a drowning, but the intoxication would be considered a significant contributing condition. But because of what I said about alcohol forming from bacteria after death, if the body is decomposed, you have to subtract some of that alcohol because it may have been caused by bacteria and may not have been a sign of intoxication. And you can have up to 0.20 gram percent. So 0.08 is above the legal limit in most states for driving, but you can get up to 0.20 in a massively decomposed body. So it really throws you off when you have decomposition and alcohol to try to figure out whether there was alcohol on board or whether all of it's just been made by bacteria. So I hope this answers some questions about what I saw in the press conference, what other people saw as well. I will go through the autopsy, or at least the report that's been released with a fine-tooth comb, but this is just my first impressions based on watching the press report.
Why do we accept an answer just because someone sounds confident saying it? Why does our brain stop questioning the moment an official speaks with certainty? And what happens when the one thing that could give us real answers is locked away where almost no one can see it? That's exactly what's happening right now in the Nolan Wells case. Investigators, journalists, and now a forensic doctor are taking a fresh look at everything, and they're seeing things differently than they did just months ago. A medical expert reviewing what's available has raised something significant: the possibility of manual strangulation. That single statement has thrown everything wide open again. So what made this trained forensic professional question what we were all told? What exactly did they get to examine? And maybe more importantly, what weren't they allowed to see? These questions matter because they shake the very foundation of what the public was asked to believe. If you're finding this valuable, do me a quick favor. Hit that like button, subscribe so you don't miss what comes next, and drop a comment letting me know where you're watching from. It genuinely helps more than you'd think. Over the next several minutes, we're walking through the medical findings, the forensic logic, and the details that rarely make headlines. By the end, you'll understand exactly why this doctor's assessment has become one of the most talked about developments in this investigation, and why the real truth might be sitting somewhere nobody's been allowed to look. Documents in this case are coming out slowly, piece by piece, and honestly, the channels that rush to be first are usually the ones getting it wrong. We'd rather get it right than get it fast. That only works if you're here when the next piece drops. Let's talk about what should have happened, because understanding what went wrong means knowing what the process is supposed to look like. A cause of death isn't something you guess at while standing at a scene. It's something you arrive at only after testing and ruling out every other possibility. In this situation, that order got flipped before any formal examination even began. Days after Nolan disappeared, the sheriff overseeing Jackson County stood in front of cameras and told everyone there was no foul play. At that exact moment, no autopsy had been done. No pathologist had looked at the body. The investigation was, by any measure, still just getting started, and yet the public was handed a conclusion like the case was already wrapped up. Here's something most people don't know about forensic pathology when a body is recovered from water. Drowning is what's called a diagnosis of exclusion. That means an examiner can't just look at a body pulled from a lake and write down drowning. Water hides almost everything. Someone can drown, or they can die from something completely different and end up in the water afterward. Visually, those two scenarios can look nearly the same. So the examiner has to work backward, ruling out head trauma, neck injury, drug toxicity, internal damage, all of it first. Only once every other explanation has been eliminated can drowning be listed as the answer. That's standard procedure, it's not optional. The sheriff's public statement skipped that entire process. He gave the ending before anyone had opened the book. Now let's add in the timeline, because it matters more than most people realize. Nolan was a teenager who'd been missing for several days before his body was found in the water on July 6th. Every single one of those days changes what a body can still tell an examiner. Decomposition doesn't pause while investigators catch up. Submersion changes tissue. Time erodes detail. The moment Nolan was recovered, every additional hour worked against the accuracy of whatever came next, which makes it even more concerning that the public announcement came so quickly and so confidently, precisely when caution should have been at its highest. To be fair, maybe the sheriff saw something at the scene that shaped his statement, but an observation at a scene isn't a documented, peer-reviewed finding. It's not something an outside expert can evaluate. A statement made on camera carries enormous weight with the public, whether or not it's backed by science yet. Once officials say accident, that label follows the case everywhere. It shapes how aggressively evidence gets pursued, how the public sees new information, and how much pressure exists to dig deeper. You examine first, you conclude second. Here, that order was reversed, and once reversed, it's incredibly difficult to undo. Nolan's family didn't accept that quietly, but they also didn't respond with public outrage. They responded by hiring their own independent pathologist and bringing in attorney Benjamin Crump, a name familiar to anyone who follows cases where families believe the official story isn't the whole story. An independent autopsy was performed on July 10th, just days after Nolan's body was recovered, giving a separate examiner the chance to test the state's version against the actual physical evidence. But a second autopsy is never a clean restart. By the time it happens, time has already done damage. And in forensic science, time destroys information rather than preserving it. A body is a kind of physical record, but it's a record that fades with every passing hour. In this case, the body had already spent days in water before recovery, then went through the state's initial autopsy, and only after all of that did the independent examiner get their turn. Refrigeration slows decay. It doesn't stop it. Water only complicates things further, softening tissue and displacing details an examiner depends on. The second pathologist was basically reading a document that had already been left out in the weather. The result of that independent exam wasn't accident. It wasn't homicide either. It was something more precise, undetermined. That word gets misread constantly, so let's be exact about what it actually means. Undetermined doesn't mean nothing happened. It doesn't mean the family's concerns are baseless. It means the available evidence wasn't sufficient to close the door on any single explanation. One side delivered a fast, confident answer. The other side, looking far more carefully, admitted they couldn't be certain at all. That isn't two experts disagreeing over interpretation. That's a professional declining to overstate what the evidence actually supports. So why couldn't the independent examiner reach a firmer conclusion? They had the training, they had the family's full cooperation, they had the body in front of them. What they didn't have was complete access. Because an autopsy can only examine what's physically present, and in this case, something essential was missing from their table. Not lost to decomposition, not destroyed by water, simply withheld. That missing section was the front of the neck, specifically the internal structures forensic examiners call the neck block. It had been retained by the state medical examiner's office and never released along with the rest of the body. When the independent pathologists conducted their exam, that entire region simply wasn't available to them. Here's why that detail matters so much more than it sounds. Different causes of death leave evidence in different locations. And when the question involves manual strangulation, the evidence concentrates almost entirely in the front of the neck, not the back. The back is mostly muscle and spine. The front is where the airway sits, where the major blood vessels run, and where the physical signs of pressure would appear if they exist at all. There are three specific things a forensic examiner looks for in cases like this. First, the hyoid bone, a small, delicate, horseshoe-shaped bone sitting high in the front of the throat. Unlike most bones in the body, it's largely unprotected, and in some manual strangulation cases, it can fracture under pressure. Second, the strap muscles, the thin muscles running down the front of the neck, where tiny blood vessels can rupture internally under compression, leaving signs a trained eye can detect even when nothing is visible on the surface. Third, petechiae, the pinpoint hemorrhages that appear when small vessels burst from sustained pressure, often found in the eyes, the face, or the lining of the heart. Together, these three signs form a recognizable pattern, and pattern recognition is the foundation of forensic pathology. All three of those signs live in the exact region that was retained and never handed over. Which brings us to the doctor's recent statement. A pathologist reviewing the available materials could only point to the obvious limitation. Without the front of the neck, you cannot confirm strangulation, but you equally cannot rule it out. That's the trap at the heart of this case. It isn't that the evidence proves anything. It's that the evidence capable of answering the question was never placed in front of the people trying to answer it independently. Now, in fairness, retaining tissue during an investigation isn't automatically suspicious. Medical examiners do this regularly, sometimes to preserve material for further study, sometimes to hold it as evidence. On its own, retention proves nothing wrong. But here's why it still matters. If the state retained that tissue, the state examined that tissue, and whatever they found from it exists somewhere in the first autopsy report, a report the public still hasn't seen. The retention itself isn't the scandal, the silence surrounding it is. There's a second complication in this case that sounds simple on paper and isn't: the toxicology. A number on a lab report looks objective, but one particular measurement can be deeply misleading without anyone lying about it: blood alcohol. In a fresh case, a blood alcohol reading usually reflects exactly what it appears to, but this wasn't a fresh case, and that changes the math entirely. After death, as a body begins to decompose, bacteria become active, and those bacteria can produce alcohol on their own, entirely separate from anything the person actually consumed. In bodies that have undergone significant decomposition, this internally generated alcohol can climb high enough to cross a legal threshold based purely on bacterial activity, not behavior. Given that Nolan's body spent days in water before recovery, any toxicology reading tied to alcohol needs to be interpreted with that decomposition factored in, not taken at face value. A careful examiner accounts for the level of decay, checks supporting chemical markers, and adjusts accordingly. Anyone treating a raw number as proof of intoxication without that context is working with an incomplete picture. There's also a human side to this story, separate from the forensic details. At one point, a reporter showed up in person, pressing for direct answers instead of relying on second-hand statements. The tone had noticeably shifted. Early confidence had been replaced with a much vaguer phrase: "The case remained under active investigation." Notice the contradiction embedded in that. You cannot simultaneously call something a settled accident and describe it as actively under investigation. If it's still being investigated, it was never as resolved as it initially sounded. When pressed for specifics, officials offered little beyond deflection, pointing toward other departments rather than answering directly. This is where broader questions started forming among the public, not accusations, just fair concerns. In a small county, officials frequently know each other and operate within the same close system. That alone isn't wrongdoing, but it does raise a legitimate question about how confident the public can be that a review stayed fully independent when the people conducting it are personally connected. That question is precisely why independent oversight exists in the first place, and why the family sought a second opinion at all. So here's where things currently stand. A misleading toxicology figure that requires context to interpret correctly, an official statement that softened considerably under direct questioning, a family asking only for transparency, not blame, and a public wondering whether the review process itself can be trusted from the inside. Two very different problems, one rooted in science and one rooted in process. But they both circle back to the same missing document, the first autopsy report, which nobody outside the state has seen. There's a meaningful difference between a case being unsolved and a case being unfinished. Unsolved implies the answers are gone entirely. This case is unfinished because the answers still exist. They simply haven't been released yet. Three specific things would move this case forward. First, the original autopsy report itself, the state's documented findings that could explain the condition of the body and justify why certain tissue was retained in the first place. Second, the retained neck tissue, which hasn't been destroyed, only withheld, meaning an independent, qualified examiner could still study it directly if given full access. Third, a complete and properly interpreted toxicology report, one that accounts for decomposition rather than presenting a raw number stripped of context. None of these require speculation. They require release and access, nothing more. To be completely fair, no crime has been proven here. Nobody has been charged. The independent finding remains undetermined, and nothing in this video claims otherwise. What's undisputed is that a conclusion was delivered publicly before the examination was even complete. And that single decision is what set this entire debate into motion. The family isn't demanding a name or a conviction. They're asking for something that should be far simpler to provide: documented, released, verifiable truth. Release the report. Grant access to the retained tissue. Finish the toxicology properly. Whatever the evidence shows, whether it points toward an accident or something else entirely, the family deserves an answer they can actually stand behind. We don't have the ending of this story yet, but we know precisely what it will take to get there. And when those documents surface, we'll be here breaking them down clearly, without spin, and without waiting for someone else to explain it first. If you want to be here for that moment instead of catching it secondhand later, subscribe now and turn on notifications, because a case like this doesn't stay quiet for long, and the next update could come at any time.